Can you introduce yourself and talk about your work?
My name is Péter. I am a psychiatrist and psychotherapist in Switzerland. I'm married, I have 3 children, and my wife is also working as a psychiatrist. We are working in the same practice and also doing psychedelic work together. So I am interested in psychedelics since 34 years now. I'm member and president of the Swiss Medical Society for Psychotic/psychedelic therapy, and I was running 2 LSD studies in the last 15 years, and in the last 8 years we have in Switzerland also the opportunity to get individual permission for individual treatment with LSD, MDMA and psilocybin.
What brought you into this field? What is it that it makes psychedelics so interesting for you?
That I came to the substances was a coincidence in some way. I didn't really plan for that. I heard about a therapist in the city I lived at that time, had special permissions to work with these substances, and I met him as a colleague, and I thought this is just a unique thing. Just one time in my life I will be just to know, as a psychiatrist, maybe it's interesting to know how that works, but then it turned out to be a very personal and existential experience for me, this first MDMA session, and so I went in therapy also with this therapist and in training, and since then I'm always interested, because I think what helps me can help my patients also.
Why there is so big interest in the therapeutic community about psychedelics? What is their potential in healing?
So I think those people who like to do therapy, the majority is like me. They have a personal involvement, a personal experience where they think that is important for my life and is healing in the wounds of my life. So I can, in that work, help other people to make the same experience. I think that is the fascination. Then to bring it up from underground into the legality, that has different reasons. I think one is that psychopharmacological research is in a dead end. There is no innovation, so the reconsideration of the psychedelic drugs is an attempt, I think, to get new ideas for the industry also, and also for psychotherapy, for psychiatry, and that helps now to bring it out from illegality. And then third, now I think that the business interest is like a hype. Investors hope to get good and big profit from it, and they invest in the hope that it turns out to be a good treatment.
How do psychedelics compare to other traditional psychiatric drugs?
So I think for the neurobiological mechanisms, you have had other experts to tell you how it works. On the psychological level, what I see as a therapist is that people get into a profound contact with themselves, with the whole personality, in the sense of they see the good and the bad. Albert Hofmann say heaven and hell, also in the outer world, in the inner world. It is a kind of holistic approach to learn about the whole, not only about the symptoms. And that is what patients say. They say, I felt connected to the whole world, to the universe, to God, but also to myself, to my wounds, to my past, to my parents, to my relatives. And in that sense, it is a deep experience of human beingness and also symptomatology. That's why we use it in therapy as well as in personal growth experiences.
Is it the substance that has this healing potential, or it's only the substance embedded in this therapeutic context and as assisting psychotherapy?
Yeah, that's the great question. I think there is a great interest now, if it would be possible, to have the potential and the healing potential of these substances without psychedelics experiences. Like you take the pill, you sleep overnight, and you wake up perfectly healthy and happy for the rest of your life. That's the dream behind that, and I am not so optimistic with that. And maybe I hope a little bit that it will not turn out to be like that. It is more a catalyst and a helper for a personal psychological process, a growing process or a healing process that needs time, that needs also guidance and reflection by other people. But because we as humans, we are social beings, we need the feedback of others, we need the help of others. And so I think it's more like a tool for a psychotherapy, for deepening or improving a psychotherapeutic process, not necessarily for speed up the growth. I'm suspicious about this.
Can you explain how this works in the real world, like the therapy itself, assisted with psychedelics?
Yes, so I would say the archetype of a psychedelic therapy, like I do it, is people come to me in psychotherapy. We have a preparation phase of a few sessions to several months where we decide to do psychedelic assisted therapy. And in this preparation phase, the patient learns about the method, how it works, and then we plan and have to apply for a permission. If I get the permission, then we prepare for the session itself. That is, or in a group setting, a workshop over 3 days, or it is an individual session, just one person and me. And then is the experience. And after the experience, we do an integration of that experience of several months. And then 3-4 times a year, patients have psychedelic sessions. And the therapy goes for 2 or 3 years, sometimes more, sometimes less.
Do you have any exclusion criteria, like people you definitely would not work with?
I have exclusion criteria. So basically I say this therapy helps where psychotherapy helps. So this is a broad inclusion. But the exclusion is I would not treat people with psychotic diseases like schizophrenia or manic depressive disorder, bipolar disorder, or people with severe personality disorders who cannot contain a stable relationship. There it is more a relationship problem, that relationship is not stable enough to go through such difficult experiences. And I mean, that would be dangerous if people walk out and go away because they are disturbed by something like that. That is the reason for borderline. In individual cases, I could imagine that you could treat also people maybe with psychotic diseases or with borderline personality disorders in the individual case. But in general, this is for me a contraindication or a counterindication.
Can a psychedelic experience induce a psychotic episode in an otherwise healthy individual? And if yes, how do you mitigate that risk?
Yeah, from a psychopathological view, the experience itself is a kind of psychotic experience because you lose the boundaries of a normal everyday reality, but this is maybe hair splitting. You mean a pathologic psychotic episode? Yes, that's possible. For vulnerable people, these substances can be the start of a psychotic episode. That's why we don't take patients with schizophrenia, but also people with undiscovered vulnerability can have psychotic crisis. That's possible. So we try to select the patients as carefully as possible because we do not want to push someone in a psychotic crisis, because normally this is nothing productive in the sense of this patient must have the psychotic episode to heal. That I don't believe that.
What kind of training professionals need to provide psychedelic therapy?
What kind of training do they need? That's a big question at the moment. So I'm not coming from formalized training. So I'm really, they call it the generation of the pioneers. So it was, by me, mainly it was learning by doing. And I encourage people just to see it also like this. This is a lifelong learning, what you are doing. It's not a training of 2 or 3 years, then you are finished and good, and then hop, it goes on the rest of your life. Of course, you have to do supervision, intervision for that. I think we need a formal kind of training in the beginning to know about the substances, to learn about the therapeutic techniques, to, yes, what you can learn as a tool. You should learn before you start, that's for sure. But then you should be curious, you should be willing to collaborate with others, you should be willing to talk with others about your faults and mistakes, and then I think you are on the way.
Do you think therapists need subjective experiences with
Absolutely. I think that therapists need subjective experiences because the experience itself is highly complicated. It's multi-layer experience, and you don't talk. Most of the time you don't talk, so you cannot ask the patient, what is going on with you, tell me. When you do that, it's disturbing. You cannot always take, what are you experiencing now? So you must have an idea what can happen, and then you have to follow intuitively in some ways, and this intuition comes from, is rooted, is grounded in experience. And we don't have that, you will be very worried or anxious when something happened that you cannot explain. In that sense, I'm convinced that we should make it possible for trainees to have a self-experience.
This is a multi-hour session we're speaking about, so that must be very exhausting for the therapist. So how does it look like from your perspective? How do you feel during the session?
Yes, it is. It is an exhausting work to guide a therapy session with LSD. It's maybe 8 to 10 hours. You are with the patient in one room, silence, music, little talking. And in the evening, normally I'm really tired. Although I was sitting around the whole day and did nothing. That's surprising. But the sitting around means I have my attention not focused on the patient, but I have my attention is in the room, so I am always ready to react if necessary, and if it is not necessary, I'm just there. Play music, I'm just there. And this is not meditation to go totally inward, but this is a kind of attention into the room. I'm not staring at the patient all the time. And I think this is work. This is work that is exhausting. In addition to that, it can be difficult because there is difficult emotions when patients are in a deep despair for several hours and they are stuck in a topic. They have a lot of anxiety and seem not to progress. There to stay calm and to be confident that will go over, and to support and guide the patient through that. That is in addition to the normal work. It is exhausting. It's a difficult work, so to say.
Psychedelic-assisted treatment is still something for the middle class, the upper middle class. Do you think that the costs can be reduced and it can be made available for the wider public and especially for marginalized people?
So my great endeavor is to make it a therapy not only for rich people. I think that's important. But I think it will always be a treatment for motivated people. So people must want this, because if you treat unmotivated people, it's dangerous. Then they will things will happen which is not okay to them, and they say, well, who the hell brought me into this situation? And then they go out. And so the motivation is important. And maybe marginalized people have not that much time to care about themselves and to consider that they need some important experiences. They are more on the fighting of the everyday life, so they are maybe not so prepared. But I think it's possible for everyone who is capable to look inward. I think this treatment should be possible.
You did the first human LSD study after the long break, the long ban. How do you feel about the current wave of new research in this field?
Me?
Yes.
Yeah, I'm happy with that, because that was my goal to make a contribution to bring LSD into medicine again. And then at the time when I had the first approval for my first study, Albert Hofmann was still alive. And I met him then for the first time in person when he was almost 101 years old. And he said, yes, he is happy that I am now have the permission to work again with patients after that long time of his sorrow child only in the party and hippie scene working. So, and he saw that also as an important step, but his ultimate dream was that LSD also would be a tool for healthy people, just for personal growth, having somewhere a retreat center in the mountains, and that also people like you and me and him could go for personal growth, but of course also for medicine.
How do you see the future of psychedelics? Will they find their way into mainstream medical care?
So my overall prognosis about the future is that MDMA will be a prescribable medicine in 2 years. For psilocybin, I think 4 to 5 years, and for LSD 8 to 10 years. When there is not a major backlash. Major backlash is possible always when bad things happen, when people committing suicide during a session, then that will be very difficult then to go on with the treatment where people are dying. And so we are not on a solid ground. And the actual hype about this substance is majorly an economic hype, I hope, and I think this will collapse in the next 2 years in favor of a normal development that is not so quick and not so easy and not so booming as it seems now, but a more consolidated kind of growth that will lead us to the goal that these substances are available again.